Hello, my name is Nathan Campbell, and for the next few minutes, I'm going to talk to you a bit about on-ice management of concussions. Before we begin the presentation, let me give you a little bit of background on myself. I'm a certified athletic therapist and have been working with sports at various levels for over 15 years. So I come today with a lot of professional experience in the management of concussions on field, but I also have personal experience with concussions. I myself have suffered multiple concussions through my participation in sports over the years. So with my professional experience and my personal, I hope to give you a little bit of insight onto on-ice management of concussions. So now let's take a look at some clips of some hockey players suffering some very severe head injuries over the last few years.
Hockey? Hockey's our game. But really, it's much more than just a game. It's a passion that brings us all together. On frozen ponds, at the community rink, and in our living rooms. It's the feeling you got the first time you stepped on the ice. The feeling you had when you scored your first goal. Hockey is in our driveways. It's in our dreams, in every post-game celebration. It's in the streets every time your friend yells, "Car." In every rink across the country. It's in our hearts. Hockey is that thought inside your head saying, wouldn't it be amazing? Getting up every day and playing.
Doing something that you love to do.
Tim Horton celebrates hockey as it brings together all Canadians who love this game.
So a term we often hear in the sports field is, you got your bell rung. So here's a question for you. Is getting your bell rung not a concussion? Is it sometimes a concussion? Or C, is it usually a concussion? Or D, always a concussion? What do you think? The answer is actually D. It's always a concussion. Getting your bell rung is an old term that was used to describe how a player may have felt after getting hit or having a fall. The player may have felt different. They may have had a headache. They may be seeing stars. They may be dizzy. These are all possible symptoms of a concussion. Symptom is something that you actually experience yourself. Something else you may experience as part of a possible concussion is unsteadiness on your feet. This is actually a sign. A sign is something that you can see, something that somebody else would see you doing after a possible injury. Some common symptoms that you may feel are headache or dizziness. You may also be seeing stars or possibly feel nauseous. These are symptoms that you may feel or experience, just a few of them. Some signs that you may experience are confusion. Now, confusion can also be a symptom, but it can also be a sign. And how you would see this, and you could recognize it possibly in your teammates after a potential concussion mechanism, is that they're skating to the wrong end of the ice. They're trying to attack your goal instead of going to the opponent's goal. Another thing that you may feel is actually being slowed down, as if you're in slow motion. This is another symptom that is quite commonly experienced in a concussion. Really, what it all boils down to is generally you feel off. So the question you have to ask yourself is, have I had my bell rung? Have you ever experienced any of these symptoms that I've been talking about? If you answered yes, then you probably had a concussion. It is important, however, to note that you may experience some of these symptoms without having a potential hit or falling. This is a mechanism. This does not mean that you've had a concussion. What it is you have to have a potential mechanism of injury, an MOI, with the associated signs and symptoms of a concussion, and that results in a concussion. Concussion math. This is when you get a hit and then you feel off. That is a concussion. So now what you do? You got hit, you're not feeling right. What are the next things that you have to do? First is ask for help. Ask for help is very key. Even if you've skated off and you still don't feel right, ask your coach, ask some other official to help you. This is very key, and so that you can start the recognition process and the healing process of a concussion. Secondly, wait for help. If you're down on the ice and you feel like you cannot get up or do not want to get up, don't get up. Tell a ref. Get somebody to get a ref. Get them to come and help you and get off. You may need some further or more advanced medical care. Thirdly, don't play through it. The old tough guy mentality just doesn't cut it anymore. concussions are very, very serious and significant injuries to your brain. Your brain is developing, and if you injure it, it has to take time to heal as well. Playing through it just doesn't help it anymore, especially if you get hit a second time. There is a controversial condition called second impact syndrome. It is a very rare but deadly condition. It is the result of a second hit or concussion to your brain on top of a non-healed concussion. This is a condition that is very preventable, and the way to prevent it is to not play while you're injured with a concussion. You should be medically cleared to return to activity by a doctor that is very knowledgeable in concussion management, and medically cleared to return to sport, which involves exertional testing. This is to ensure that you can actually withstand the rigors of the sport and be able to return to play at an optimal level. As a teammate, you also have the responsibility, and you can also play a very key role in recognizing potential concussions. You should follow the same guidelines as if you were to receive a concussion yourself. But the way you look at it is you should ask for help. If you notice a teammate on the bench or on the ice that is suffering potentially the symptoms of a concussion after they got hit, then you should ask for help. Tell the coach, tell the rep, tell somebody in higher authority that they potentially may have a concussion, your teammate. This is only to look out for their health. The second thing that you should do is wait for help. Don't try and help the athlete off the ice. You may not know what else is injured. Let them stay on the ice, wait for more advanced medical help, tell the ref, get somebody over there to help that person or your teammate. Now, what if the injury is more severe? What my advice is, do not get up. Wait for more help. Get the ref over there to help you. Get the coaches, get the medical staff. If you feel like you need to stay down, stay down. Don't try and get up. You may be more hurt than you actually know, and you may not know how hurt you are until you try to move. So stay on the ice. Wait for help. And the same goes for your teammate that may be down after a hit. Don't try to help them up. They may be more injured than you actually know. So let the ref or let the coaches come and deal with that injury. Don't try and help them up because you may cause more damage. In the end, you need to ask yourself, if after you get hit, do you feel off? Not every hit results in a concussion. It doesn't matter how hard the hit is. Some hits will result in a concussion and a lot will not. The key here is if you feel off after concussion, then tell your coach. The same is true of your teammates. If you notice one of your teammates after a hit acting weird or strange, then bring it to the attention of your coach. So in the end, the take-home message here is, when in doubt, stay out. If you have a possible concussion and you recognize these signs and symptoms, don't play through it. Stay out of the game. Stay out of the practice. Do not return to the activity. I want you to know that concussion is a very serious injury and that can carry very serious consequences if you do not deal with it properly. There are proper steps laid out in order for you to heal your brain. Like every other injury, your brain takes time to heal. After all, you only have one. Now I'm going to talk briefly about concussion management for coaches. Here's a question. What should you do if you suspect your athlete suffered a concussion? Should you A, remove the athlete from play and see if they get better? If they do, allow them to return to play. B, after a day's rest, if they're feeling okay, allow them to return to play. C, remove the athlete from play and not allow them to return to play until medically cleared to return to hockey. Or D, remove the athlete from play and not allow them to return until they have been cleared to return to activity by a doctor. The answer is actually C. Remove the athlete from play and not allow them to return to play until medically cleared to return to hockey. So if you suspect a possible concussion, you are to remove the athlete from the activity, from play, and that could be a game, that could be on ice practice, that could be dry land training. Whatever the activity is, you need to remove them from that activity. The player should be seen by a doctor and not be allowed to return to play until medically cleared. They should also be cleared for return to sport. This involves a series of steps that progressively advances them through a physical activity, ultimately ending in their return to play. The key here is, when in doubt, sit them out. So, if one of your players receives a hit and doesn't report any possible signs and symptoms of a concussion, Your key here is to actually monitor them. Look out for any signs. If you notice anything out of the ordinary, if they're not performing at their normal ability or to their normal skill level, then assume a possible concussion and take the next steps then in order to medically clear them or medically assess their possible concussion. So if you notice any of these signs, remove your athlete from play. Again, it's always important to err on the side of caution here. So when you're in doubt, again, sit them out. Next question. What should you do if a player is on the ice unconscious after a hit? Should you A, call 911, B, stabilize the neck and head, C, let them get up when they come to and skate back to the bench, or D, option A and B? The answer is D. You should stabilize the head and neck and call 911. So in this situation, there actually may be a more serious possible spinal injury. That's why you want to block the head and minimize any movement. You don't let the player get up. Some more advanced medical care, call 911, get EMS on scene. Let them then handle the athlete and take the proper steps in order to care for their injury. So another important tool that you can put in place is actually an EAP, an emergency action plan. The next slide is actually a demonstration of the EAP, a blank one, developed by Hockey Canada. In this plan, it outlines what is to happen in the case of emergency should 911 and EMS be called to the scene. This plan also has details about the address of the venue and any potential emergency tools, for example, an AED, on site and their location. The plan should also detail the roles of different people involved in the emergency response. There should be one person in charge of the situation. This is usually the person with the most advanced medical training. There should be a call person. They are charged with placing the 911 call and directing EMS to the location of the emergency. And there should be a control person. They are responsible for controlling bystanders at the scene, ensuring that more advanced medical personnel have clear access to the scene. So on the next slide, you're going to see an example of the pocket card. What you see here is the pocket concussion recognition tool. This is a useful tool to keep with you on the bench. It allows you to remember the signs and symptoms of a potential concussion and aid you in the recognition of a concussion. This slide actually represents there's many tools out there for smartphones, for iPads, that can aid also in your recognition of a concussion. This is just one example of one. Some take-home messages. Be familiar with the signs and symptoms of a concussion. This is your biggest tool in recognizing any potential concussions. Don't allow your athlete to return to play if they are experiencing the signs and symptoms of a concussion. But keep in mind, these symptoms have to be related to a potential mechanism. If they're just sick, they're just sick. But if they've actually had these symptoms and are experiencing these symptoms or presenting with these signs after a hit, assume a concussion. It's also important to note that as a result of a concussion, a player may not be able to attend certain team functions. They may not be able to attend practice. They may not be able to attend a game. They may not be able to attend any social functions. It's very important to let the athlete's brain heal. Require your athletes to get medical clearance to return to both activity and to play. These are different. An athlete will be able to return to daily and physical activity before they're able to return to play. Get the player to get medical clearance to return to activity, followed also by clearance to return to play. This involves exertional testing. You're going to see some examples of this protocol in the next segment. In the unfortunate case of any more severe medical emergencies, where you have to call 911, know your facility's EAP. This is a helpful tool that in the times of emergency will just let things run a little bit more smoothly. And the biggest thing here is, when in doubt, sit them out. If you suspect a concussion, sit your player out. It's only for the betterment of them. Thank you for your time. If you have any questions, please do not hesitate to ask.